Welcome, and thank you for your interest in the work of the Data Committee of Houghton Keweenaw Communities That Care, and for taking the time to help us choose priorities to address in community-based, youth-focused prevention programs. With Communities That Care, we join forces, families, schools, and communities to help young people make healthy choices. We can all contribute to making our communities supportive and safe for young people. With Communities That Care, we follow where the local data lead us to be more effective and measure progress over time. Our data committee analyzed survey results from nearly 500 students from 4 area schools. The anonymous surveys, which took up to an hour for each student to complete, asked many questions about attitudes, perceptions, and behaviors to help create a portrait of our local youth, families, schools, and communities with regard to factors that may influence substance abuse and other problem behaviors. Let's look at a few of the survey findings. The survey uncovered many areas where local youth scored better than national data, including high percentages for belief in moral order and family attachment, and 5 key areas where our youth ranked worse than nationally. These characteristics are called risk factors in prevention science because they put young people at higher risk for early alcohol, tobacco, and drug use, and for other negative consequences such as teen pregnancy or school dropout. Let's look at the 5 risk factors identified by the Data Committee. First, local students self-identified as poorly performing in school at higher rates than their peers nationally. Despite what objective data may say, and our local schools are high performing, our students do well on standardized tests and graduate at high rates. For young people, their perception is their reality. Many local students reported feelings linked with depression, another risk factor for substance abuse and other problems. About 4 in 10 local teens reported depressive symptoms, similar to national adolescent data, and about twice the rate normally observed in adult health surveys. The teen years can be emotional and turbulent for many young people. Low commitment to school is a risk factor that has emerged in youth surveys across the Upper Peninsula. A sizable portion of local teens across the UP don't have a strong positive connection to their education, and studies show that makes them more likely to drink and smoke and do poorly in school and beyond. Many local students do not perceive drug use to be risky or harmful. About half the survey respondents at each grade level scored at a low perception of risk of drug use, obviously a predictor for risk of early substance abuse. Many local students indicated that antisocial behaviors are encouraged or supported among their peers and in their communities. More than half of local 12th graders reported rewards for antisocial behavior, similar to the national rate. So what does it all mean? Studies show that young people with 1 or more risk factors are more likely to act in ways that can be unhealthy or harmful. From our local survey data, about 1 in 3 12th graders reported drinking alcohol in the past 30 days. About 1 in 5 smoked marijuana in the past month, and about 1 in 5 used tobacco products. Tobacco use rates among youth and adults tend to be higher in the UP than nationwide. So now it is up to you to help us winnow the 5 elevated risk factors: academic failure, depressive symptoms, low commitment to school, low perceived risk of drug use, and rewards for antisocial behavior, to the top 2 we'll focus on this year and beyond. All are important, but choosing the 2 with the greatest community support will help us be focused, targeted, and effective in future prevention efforts. Think about which factors you find most troubling, or which ones you think we can tackle together as a community, building on our strengths. After this presentation, select your 2 choices by checking 2 boxes and clicking Done. After the CTC identifies the 2 priority risk factors, we'll work to develop new programs or bolster existing ones to create a more supportive and safer community for youth. You can get involved by joining our community board or a work group, and by example, with clear and consistent messages for youth about not using alcohol, tobacco, and other drugs, working hard in school, and believing in a positive future. For more information, call Megan at Dial Help or visit the Houghton Keweenaw CTC website. Thank you again for your time and interest, and special thanks to the Portage Health Auxiliary.